Medical experts who've been monitoring trials of plasma therapy as a possible life-saving measure for critical COVID patients say there's a certain amount of lethargy when it comes to plasma therapy, and plasma that is available is exclusively for ICMR-run trials and not yet available for other patients. They are also calling for the repositioning of plasma therapy and not let it become a last-minute salvage therapy.
This is my second birth. I have come back again. I have been treating COVID-19 patients from day one, right into the ICU, to the isolation also. My request to all my Indian citizens, brothers and sisters, is all those who have been affected by COVID-19 and who have gone back home, please, I am requesting them with folding hands that they should donate their plasma because it is the need of the hour and will be able to save many lives.
An appeal from one of Mumbai's best-known doctors. Plasma will be able to save lives. After being affected by COVID-19 himself, Dr. Jalil Parker, well-known pulmonary physician, spoke about the bureaucratic hurdles in treatment for COVID-19, especially plasma therapy. This after the ICMR came down heavily on the civic body-run Nair Hospital for distribution of plasma units to hospitals not registered for the trial and even threatened that the trial could be taken away from them. Nair Hospital had been given permission to conduct trials for plasma therapy along with Kasturba Hospital at that time.
आज की तारीख में हालात ऐसे हैं कि हमें बहुत ज़रूरी है कि हम मरीज़ को बचाएं और मरीज़ को बचाने के लिए हम रेड टेपिज्म में नहीं पड़ना चाहते हैं। हम सारी कोशिश करते हैं कि मरीज़ को हम कैसे बचाएं। तो आप लोग ये जो बाधाएं डालते हैं हम पर कि पेपर वर्क होना चाहिए, पेपर वर्क नहीं हो गया तो तुम्हारे पास केस कर डालेंगे, प्लाज्मा दिए तो केस करेंगे, रेमडेसिविर दिए तो केस करेंगे, रेमडेसिविर अवेलेबल नहीं है, टोसिलिजुमैब अवेलेबल नहीं है, तो ये सब चीज़ों से हमें बहुत दिक्कत होती है और हम लोगों की जान बचा नहीं पा रहे हैं।
Doctors monitoring plasma therapy trials say there needs to be a complete relook at the plasma therapy regime. Currently in Mumbai, only patients who are registered for the trial can be administered plasma. Experts add it should not be used as a last-minute salvage measure for critical patients.
I think that we need to look at repositioning plasma. In fact, I don't think we need to wait for plasma for patients to get into the severe disease, because at that time, when you get into severe disease, you are looking at plasma as, look, if nothing is working, let us try plasma. Once you know that you're dealing with somebody who's most likely to get into a complication, you ought to be offering the plasma at that stage and not waiting for it to become a last-minute salvage therapy when patients are on ventilator and nothing else is working.
Doctors say there is a lethargy when it comes to applying plasma therapy on patients who are dying.
I think that the problem is not so much about people who are being infected. I think there is, for a term that can be applied loosely, there is a lethargy. We are not making it important enough for people who have recovered to donate plasma. I think it is very important for this to be made into the mindset of people who have recovered, that this can very easily become a therapy. It's no more complicated than simply giving a blood, a pack cell that you would give as blood donation.
Medical experts say the ICMR coming down heavily on Nair Hospital has led to lesser instances of plasma therapy being explored as a life-saving measure for critical COVID-19 patients. They say if the stringent protocols are relaxed, then donors will automatically follow appeals from public personalities for plasma donation. In Mumbai, with camera person Rajendra Dhayalkar and Pooja Bhardwaj, Saurabh Gupta, NDTV.